For the last year, I have been the Associate Dean for Public Health for Michigan State University College of Human Medicine. This whole public health enterprise for MSU is based in Flint, Michigan. A really novel partnership with the community to work hand in hand to address public health issues and to share our best practices throughout the nation.
So we're here, obviously. It's been 10 years since the crisis. Talk a little bit about thinking back on what's gone on the last decade here in Flint, Michigan, and where are we today?
Sure, it's been a decade. So, the water crisis started about 10 years ago, but I wasn't involved for about a year and a half later. And the nation really wasn't aware, shortly after that. So since the moment of recognizing that we had this kind of emblematic environmental and public health injustice, this preventable crisis, this is a community that has rolled up their sleeves to make sure that we are not defined by this crisis, but really defined by what we have been able to do next. So that's the busyness, that's the work, that's kind of the passion that has happened since the onset of the water crisis.
How challenging is that? Because you say Flint, and water crisis follows.
Yeah.
Changing that narrative, redefining this community, how challenging has that been?
It's not, and that has been kind of my MO, that has been the community's kind of goal, is to make sure that folks don't think about Flint as that one city in the middle of the Great Lakes that had that brown water, where we failed to care for kids. That's part of the story, but the more important part of the story is what we've been able to do next. And it hasn't been just about what we've been able to do for Flint. Our water crisis in Flint has shown a bright spotlight on issues of water quality, on issues of environmental injustice, and fundamentally on issues of how we care for each other, especially our children. And that is the story that I hope folks will come away with.
You talk about how far Flint has come. How far has Flint really come when it comes to addressing this crisis?
Yeah, so Flint's come a long way. We are almost done replacing our lead pipes. So for a year and a half, we were on Flint River water. It wasn't treated properly. It was super corrosive. It ate up our pipes. And it's taken a while, but we are near completion of replacing those lead pipes. But by and large, our water quality is absolutely better. So that's kind of where we are in terms of the water. But my work as a pediatrician is making sure that our kids and our families do not suffer the consequences of this preventable crisis. So we have been able to throw so many things at our children, things like expanded Medicaid and home visiting programs and nutrition supports and trauma-informed care services and brand new child care centers and literacy programs. All of this is weaved together by something called the Flint Registry, where we see how folks have been doing, but more importantly, unlike any other registry out there, we connect them to all these amazing things that we've been able to bring into the community. The Flint Registry has enrolled, over 20,000 people and made 30,000 connections to these public health promoting services. So lots of good things have been able to be put in place in response to the crisis, all evidence-based things to promote the health and the development, especially of our children.
You said a few years ago that children were the human detectors of this crisis.
Yeah.
Thinking back on that statement, it's pretty stunning.
Yeah, it's pretty stunning that to this day, we continue to use the bodies of our kids as detectors of environmental contamination. As a pediatrician and as pediatricians around the nation, we screen kids for lead exposure at their routine well visits when they come into the clinic for their 1 year and 2 year checkups. We check their blood to see if they have lead. And when we find out that, yes, they have lead in their blood from either paint or dust or soil or their water, it's too late for that kid. It just tells us that there's something wrong in the environment, and that's backwards. We, as a nation, need to do a better job screening environments before kids are exposed. And once again, because of Flint, we are getting there. The Infrastructure Act is finally investing billions of dollars to replace lead pipes across the country. The EPA has proposed a model drinking water rule, the lead and copper rule, that is finally mandating the replacement of lead pipes across the country in the next 10 years. And finding them, because we don't even know where they are. So we are learning slowly some of these lessons, these lessons that Flint taught us. And I think that's why I'm so grateful that you're here, and I'm so grateful that we are sharing the story, because what happened in Flint wasn't this one-off. It wasn't this story about that one city that had the brown water. It's an everywhere story. There are Flints everywhere where there are kids waking up, either, suffering from a preventable environmental injustice, or suffering literally from policies that are making it hard for them to grow up to be healthy and successful.
As you mentioned, there are lead pipes everywhere. We're in the process of changing them out in a lot of places, but that means that there are children in this country that are drinking water contaminated with lead right now.
Absolutely. Flint has opened our eyes to the the knowledge that we have lead pipes everywhere, and that in times of crisis and in times of non-crisis, kids are exposed to lead in their water. It's wonderful to see the massive investment in replacing our lead infrastructure. It's wonderful to see the stronger regulations that are happening, but it's going to take time. It's going to take time to replace all those lead pipes, and it's going to take time to make sure that when we turn on our tap, no matter if we live in Flint or Detroit or Chicago, that water is safe to drink. So until then, we need to do a better job really sharing what folks can do to protect especially children, using lead clearing filters, flushing their water before they use their water, never using hot water from the tap. There's simple things that folks can do before we do that hard work, but totally possible work, and it's starting all over this country, of replacing the lead pipes.
Before Flint, it seems like we didn't talk enough about this.
No, we didn't talk. We knew about it. We've had water crises before, but there were only a couple cities before Flint that had replaced their lead pipes, Lansing, Michigan, and Madison, Wisconsin. But we've known about what lead does for centuries. There's theories that hypothesize the demise of the Roman Empire was because they used lead in their aqueduct system. So when the rest of the world was stopping the use of lead in the early 1900s, that's when the U.S. started to put it in a lot of things like paint and plumbing and gasoline, even when we knew it was harmful for children. Lead, like so many evil industries, made a profit, off the health and the potential of our children, and to this day haven't really been held accountable for it.
When you think about it, obviously it's expensive. There has been controversy about whether or not replacing lead pipes would exacerbate the problem. Has there been consensus in the last 10 years about what we should do?
I think so. One of the last times I had the privilege of testifying before Congress, a legislator said it's too expensive. It is too expensive to dig up lead pipes all over. It's too expensive to abate homes and remove lead paint. It's too expensive to clean up soil where there's lead and gasoline. It's too expensive. And my argument, which is really based on solid science, is that there's a cost of inaction. So after Flint, there was a national report that shared our failure to eliminate lead in the environment of our children costs us about $80 billion a year.
As you mentioned, there's not only long-lasting physical impacts from this, but there's psychological, there's emotional, there's distrust issues. You talk to some residents in Flint, and they still wonder, right, whenever they turn on that tap.
Absolutely.
I asked the US EPA a very simple question. I sent them an email and I said, is the water in Flint safe to drink? They sent me a response. The word yes did not appear in that response.
Yeah.
What do you say to somebody who asks that question? Is the water in Flint safe to drink?
Yeah, so as of now, the pipes are still being replaced. Whenever you replace pipes, whenever you do earth-moving work, you have the potential to release more lead from the pipes. So my understanding is that when the lead pipes are all replaced, then that risk is no longer there, and we will be back to in compliance. I never use the word safe anymore for water. In Flint or Detroit or wherever, understanding the inadequacy of our drinking water rules, I cannot say safe. I can say it's in compliance with rules, but those rules are not fully protective, especially of our children.